Hello, everyone. Hi. Are we having a sleepy afternoon? Let's find out. Thank you so much for the introduction. My name is William Njoroge. I'm from Aga Khan University Brain and Mind Institute, and I'll be presenting a very sleepy topic. And I'm glad that everyone here is not sleepy. So I'll be talking about the sleep characteristics of healthcare workers in Kenya, which is a pilot findings using Fitbit Inspire 2. Let me just ask by show of hands, how many have a smartwatch? Very good. So mambo ni matatu. So let me just give you a brief introduction background for this. It's a study that is ongoing. So we did a pilot study last year from July till August. So among the interested things we were in is sleep, and we wanted to see how our healthcare workers are doing. So this is also an ongoing work that is currently undergoing in 5 healthcare facilities, that is Pumwani, Mamalusi, KNH, KUTRH, and at home Aga Khan. And the the background for this is that our healthcare workers have always been subjected to sleep, but we don't know how far or how sleep affects them. So this elicited some intellectual curiosity to find out from our study, which is the Uzima work using this Fitbit smartwatch. So these irregular schedules can disrupt their circadian rhythms and making it a challenge to maintain a sleep pattern. And over the past decade, there's been a lot of traction in the availability of wearable technology that can monitor various health outcomes. However, in Kenya, there is limited knowledge about wearable technology and in understanding how they assess or how they can improve mental health. So allow me to just give you a brief synopsis of how sleep happens. So sleep happens in 4 stages. Stage one, that is where you are asleep, you just got into bed or where you're supposed to sleep. You're able to hear the environment around, but at the same time you are aware of the environment around you and you are conscious about it. And then we proceed to stage two, whereby now your breathing rate, your heart rate, your everything just shuts down, and that is the uh, stage called non-rapid eye movement stage. And we have stage 3 and 4, which is quite interesting. In stage 3, that's where you are really deep into sleep, and that's where you go into stage 3 and 4, and that's where you have your sleep. Hence the rapid eye movement, because when you sleep, it's like you're able to see your dreams vividly. Hence that REM. So hence this sleep glossary. And these all are guided by the National Sleep Foundation, which have guided us globally when it comes to sleep studies. And there's also sleep efficiency, which I'll be mentioning more often in this pilot study. So sleep efficiency is the total sleep time and the total sleep spent in bed, which is calculated in percentage. And the recommended one is 85 and above. So please note 85 and above, that is the acceptable sleep efficiency. So the objective was to pilot this study using Fitbit Inspire 2, which is a smartwatch, and we were to assess, compare sleep characteristics among healthcare workers on gender and cadres. And we were looking at in 4 facilities, that is Aga Khan University Hospital, Nairobi, Pumwani Maternity, Kenyatta University Teaching and Referral and Research Hospital, and Mama Lucy. So our pilot study was 50 because it's just a 10% of our study, main study. We are looking at 500 participants. And we were using the Fitbit Inspire 2, which our participants wore for 1 month, and they will transfer their data from smartwatch to smartphone using Bluetooth and using data internet bundles. So the sleep characteristics that the Fitbit measures is mostly on sleep duration and quality, and that is the time you spent in bed, the different sleep stages, and also the deep and non-rapid eye movement stages. Also, we're looking at Fitbit, heart rate, which is beats per minute, and the amount of physical steps that they take. So we analyzed this using SPSS, and it was mostly descriptive analysis. So on the results, we're not doing so bad, which is good. So our age range was from 25 to 50, which our median age was around 33 years. And mostly they were females. Uh, and again, nurses were many who were married and were mostly in the urban setup. So what about for the sleep characteristics? As you can see on that, on the mean, especially on the average sleep efficiency, it's 82. Remember, it was 85 that is the required, or the one that is guided is 85. So 92. So tell your neighbor, you're not doing so bad. You're sleeping good, but don't sleep too much. All right. So, and when it comes to the sleep efficiency, it's really important because uh, it helps us to be awake, to be conscious, and it rejuvenates our when we sleep. And in terms of deep sleep, we are not doing so bad because the recommended guidelines, according to the National Sleep Foundation, is around 1 hour, 30 minutes. And you see, we are doing at 80. And this is just a small number, which is quite significant. And also with sleep, also, uh, light sleep, we are doing at 264 minutes. And the recommended one is around 3 to 4 hours. However, on the rapid eye movement, the recommended hours are 1 to 2 hours, which is 95, which is approximately 1 hour 5 minutes. That signals something. And our participants also spent around 428 minutes awake. That is whether you are waking up to go to the washroom or you had something, all that was captured. And that's the beauty of the Fitbit because it's very objective. So, and generally they were doing very well, even in terms of steps, according to our data. Uh, the required is 10,000 steps, and they were doing 8,000. And remember, this is just a pilot study, so not so bad. However, when it comes to the gender differences, who do you think was sleeping more, male or female? Eh? Well, the numbers don't lie, don't they? It was actually females who slept more. So, with no, with pun intended, females are sleepy, which is which is quite contrary to the literature studies because in the high income countries, it's the opposite. It's the females who sleep less and males sleep more, which signifies something about our setting. And when it comes to the light sleep, also, it was also quite significant when it comes to light sleep. Of course, there's not much that we can say. However, not to just to note that there were more female represented in our sample. And when it comes to the heart rate, again, it was significant. And I will also pose a question into to the floor to also help us infer why females have a higher heart rate beat. When it comes to the minutes, they slept almost similarly the same, also when they were asleep and also awake. So when it comes to gender differences, again, due to the gender biasness that we encountered, as you can see on the different other cadres, they were sleeping better than the doctors and nurses combined, which also says something. And again, they also beat nurses and doctors when it comes to deep sleep. And deep sleep, the importance of it is that it helps you to re- rejuvenate, and it helps you to become more uh, mental. It improves your memory and your concentration. Again, also when it comes to the rapid eye movement, there was no much difference between the two CADA differences. However, on the heart rate, again, there was quite a significance between the doctors and the nurses, which also says something about our pilot. So in general, our healthcare workers are doing well. However, this also probes more research questions and more uh, empirical evidence on sleep studies. So in conclusion, our healthcare workers with good sleep efficiency are better equipped to provide high quality care and maintain their own mental health and well-being. That is, if it cascades down, there'll be few medical errors. There'll be few feeling groggy or feeling even increasing to burnout. And I like what our the CEO for Mathari actually said. If mental health is not taken care of, then it also robs GDP. This also is very important when it comes to sleep because it can cascade down to labor, which also goes to the GDP. So this implies that sleep is also a vital component of optimal performance. And by leveraging wearable devices, our healthcare workers can detect early signs of mental ill and provide timely interventions. I would like to acknowledge the entire Uzima team and our PIs who are Professors Amina Abubakar, Akbar Walji, Zul Merali, and Prof. Lukoy. Thank you so much for your time, and I'm glad that this was not a sleepy presentation. Thank you.
Appreciate it. Job well